So why does weight predispose to certain types of complications after weight loss surgery? So in terms of the long-term complications, that is the joint wearing out or becoming displaced or even failing, cracking, I think that's easy to understand, right? So if I'm significantly overweight, that's putting a lot more force on the device itself. The device is not originally designed to handle those kinds of forces, and the device fails. So I think that's easy to understand. Why does weight predispose to infectious complications after joint surgery? So that's a great question, and it really is the mechanics of it. So when the knee is a normal size, it requires an incision like that. For the person who has very large legs as a secondary effect of severe obesity, the incision might be this long. Incisions this long have that much more chance of getting infected. It's actually exponentially more because of the length of the incision. And the incision's quite a bit deeper. Incisions through areas that have a lot of fat in them tend to collect fluid. When fluid collects in the body, doesn't matter where it is, it can get infected. This happens in the bladder. When the bladder gets blocked, people get bladder infections. When the gallbladder gets blocked, people get gallbladder infections. And so we also see this in wounds. When fluid collects in wounds, it can get infected. When an implant made of metal gets an infection, it's almost impossible to get rid of it. The implant has no ability to fight that infection itself. Our body's tissues do. So even if you get an infection in your finger, your body's going to fight that infection. Eventually it's going to go away. If it gets on a piece of metal that's implanted in you, it's probably not going to go away. And that can lead to implant removal, which is a major problem. And so that's kind of some of the reasons that you would want to lose weight before you have a joint replacement, because even though the rate of infections isn't sky high, it's not 100%. Clearly, we wouldn't do surgery if that was the case. Even the small rate, these complications can be so important that you want to avoid that small rate.